I am Michael Kuluva, a CAPA steering committee member, a patient with rheumatoid arthritis, and also an arthritis advocate. Today, I have a special guest with us, Dr. Janet Pope. She is the professor of medicine, divisions of rheumatology and epidemiology and biostatistics at the University of Western Ontario, and also the division head in rheumatology at St. Joseph's Health Centre in London, Ontario. We'd like to welcome Janet now.
Hi, Michael. It's a pleasure to be here. I'm really excited about talking to the CAPA group.
Yes, thank you so much for being here. So today we have a couple questions from patients and also people on our committee who are also patients. And we wanted to get some answers about this COVID-19 and how it affects us as autoimmune suppressed people. So for the first question, we wanted to get right into it. We wanted to ask, if we are currently taking any biologics for our arthritis, do we continue taking them during this pandemic? And if so, will the biologic medication make me more vulnerable during this infection with the coronavirus?
So that's a really good question, and I get it several times a day because people are worried and nervous. And until recently, we would say keep your biologic, but we wouldn't have good answers for you. Now, because the pandemic's been around a while, there are at least 3 publications or things in press that are suggesting very reassuring data. And what I mean by that is if you look at our patients with our autoimmune diseases, our advanced therapies like the biologics or JAK kinase inhibitors, so far it looks like people who get COVID of our patients get them at the same rate as the age and sex match background population. We also have looked, not me, but reading the data, they've looked and have found that the side effects or the severity of the COVID-19, so the people who do really poorly, seems to also be about the same. And the good things are, it's not really the immune suppression of our arthritis people living with autoimmune diseases like that. It is mostly advanced age, heart disease, obstructive lung disease, diabetes, sometimes obesity and hypertension. So it seems to be those other comorbidities, particularly advanced age, that give the higher risk of getting really sick with COVID. So the easy answer is you should take your biologics. You're not at a higher risk, fortunately, at this point in time.
Great. Well, that's really assuring to know. Our next question is, since our immune system is compressed, can we still go out for walks outside to exercise, or should we just play it safe and stay inside?
Excellent question again. So you really should go out for walks. And why? They've done lots of studies now, and this is mostly not so much airborne, but droplet on surfaces. So when you're outside in general, you're not touching a lot of stuff. You're really walking around or, walking your dog or what have you, walking with a friend with safe distancing. And so it's safer outside than, say, the grocery store, but someone does have to buy your groceries, or if you're not buying them yourself. So yes, you should get exercise, but it's also important for your mental health to go out, especially as spring is coming now and we're going to get some better weather. A lot of people are going stir crazy, and it makes them more nervous, and they have too much time to watch all the news that just can frustrate you, but also increase your anxiety. So I think getting out and being a little bit more normal, going for a walk is great. You got to follow the public orders around. You're not supposed to just be idle in a park right now, although things will be opening up more over time in each region. But you can walk through that park. You can walk around your neighborhood. You can walk in areas as long as you cross the street and do the safe distancing if there's a little sidewalk and someone's coming. And I found that most people are really respecting that distancing.
Yes, I am too. I'm really seeing that it's becoming the new normal now, and people are just already looking to avoid you when you walk towards them. So I think it's actually a good thing in a sense.
Might have a virus, or they might. We don't know.
Yeah, exactly. With the stress of this pandemic, there has been more flare-ups within patients, more than usual. Do you have any recommendations to keep these flare-ups to a minimum?
I think there's two kind of flare-ups, because sometimes people they're stressed, they're financially stressed. Maybe they have a loved one who's ill and they're wondering if they have COVID. If they have kids, their kids are running around at home with their little ones because they're not in school or they don't have the daycare. So there's a lot of stressors like that that might make you flare, and your flaring then could be, oh, I have more pain, I'm more fatigued, I'm more tired, and that is very situational. In addition, though, that kind of stress for some people will flare them. And even sometimes without stress, people flare. A lot of disease isn't a flat line. It's like a wave, right? You flare and improve, and you have this wandering baseline at times. So I think to try to keep flares at a minimum, you should really take your meds. So I think people are, thinking, oh, I'm afraid to take my meds. You're better to take them. And I think we'll talk about that later, but you should take your meds. You should be good to yourself. So have a routine, get your exercise in. You obviously can't go to the gym right now, but exercising like we talked about, eating well. A lot of people are baking, cooking. So be good to yourself. And also, if you are working from home, you're privileged enough to still be able to work and have a job that allows you to do it from home. Privileged meaning, your mind is taken doing other things and you don't worry about your health a little bit as much, a little bit less. I think it's really important to take breaks. You still have to clean the house, do the laundry, get the groceries, or give someone the order to click and get the groceries, or someone to do it for you. So don't just work 24/7, and be good to yourself and try to keep that routine, and that might help the flares.
If we are flaring up, should we contact our rheumatologist?
I think it's really key, if you're flaring, to try to avoid, wherever possible, if you're not like super sick, to try to avoid the emergency room and urgent care, because they are areas where people will come in with fever and maybe cough, some of whom might have COVID. So you want to not put yourself at risk. So sometimes it is hard to get the family docs or primary care or nurse practitioners, because they're doing phone calls. The rheumatologist might be doing phone calls, so you might call and it's busy. But I think you should really try, if you're flaring, to get in touch with particularly your rheumatologist, because there's things we can do. We can bring you in to give an injection. We could give a short course of oral prednisone. We could give an anti-inflammatory. We can give a Depot-Medrol, which some of these means coming to an office. But everybody's office or the hospital clinics have COVID procedures in place. People are screened. Most patients right now, and it changes in the region, are masked when they come to the hospital or to someone's clinic. There's social distancing, so the waiting rooms are empty. People are usually put right into a room. So I think that you shouldn't be afraid to get healthcare if you need it, and you should try to get the expert care for your disease, because I think that's way better in general, but in particular now, than going to emergency room, because you don't want to get something worse on the way home, so to speak.
Right. No, that's definitely understandable. As patients, we already feel so isolated already with our immune diseases. Do you have any suggestions or outlets for socialization within the social distancing guidelines?
So there's lots of ways. If you think, many people are kind of addicted to their phone anyway, so they have to remember they are. So they have to remember to use their phone to reach out. And just like, you might have told friends or family, oh, we are going to go out for dinner on Friday at 7. Now you have to, in a way, schedule your friends if they're not, if they forget to text you or vice versa. There's nothing wrong with scheduling. We did it before for going out to eat or going for a walk or whatever. So I think use your social media networks and reach out, and don't be afraid to say, this is getting to me. Is it just me or is it everyone? Because you can commiserate, which makes you actually feel better. But also a lot of people will talk you into a better mood, saying, well, yes, it is, it's scary times, but we're doing well in our community right now. Or I don't know anyone firsthand, or I knew someone and they got better. So you can spin it as something where we will get through it, or as they say on all these slogans, we're all in it together. So please reach out, because there are many vulnerable people, including ourselves, during this time.
Thank you. Yes, I think that's a great suggestion. If we run out of hand sanitizer and we cannot find any to replace, should we just make our own? And will it be as effective as the store brand?
So you might run out of hand sanitizer, especially the little portable ones. So first of all, in the home, you don't have to use your hand sanitizer. Soap, water, 20 seconds of washing, and remember the thumb and the back of your hands here. So 20 seconds with warm water and soap, and then you often just turn your taps off with your elbows. If it's at home, you can turn the taps off with your own hands. That is pretty good. And then if you need things like going out, you can make your own hand sanitizer. And what I'd probably do is probably the components on Google that how you make hand sanitizer are probably getting low as well. But there's hand wipes, there's sometimes even makeup wipes that have alcohol in them, but alcohol dries your skin, but that can be successful, like rubbing alcohol. There's some of these moisturizers that actually have antibacterial properties. So soap and water would be better, but in a pinch, that's not a bad idea. And I think no matter what, make sure your hands are clean one way or the other, but don't touch your face. So people can get the contact because they touch a surface and then they rub their nose or their eyes or their mouth, or they move their hair all the time and they're getting their eyes. Now, in fairness, almost all the root is nose and mouth, very little in eyes, but try not to touch your face. And then I think you just basically say, I went to go get groceries, they wiped down my cart, but I'm not going to touch anything other than myself and the groceries, but not my face. And when I get home and unload all the groceries, I'll wash up really well.
So I'm holding my hands like this, and I try to now keep, yeah, exactly. So is that something that you recommend too, is just to, keep your hands together and try to be more conscious of that and something like that, or keep them in your pockets, or
right. Or sometimes if you're doing something with your hands, sometimes people like to, well, they don't know they like to fidget, but they do fidget. So you could even be spinning a pen as long as you're not like, chewing on the pen or anything. Right. So do something that facilitates not touching your face. And it's like anything, if we say don't touch your face,
you're gonna want to touch
we all think about our face and then we think, oh, I think I'm itchy on my left cheek, right? So distract yourself as well. But just a good hand washing is really helpful. Using a Kleenex if you had to like open something in public where you're not sure how clean you are. Something's better than nothing. And obviously coughing into your arm.
Thank you. Yeah, I think that's definitely a good suggestion. And I'm going to keep doing it here. So there's been a lot of talk about the hydroxychloroquine and a possible treatment as it is for COVID-19. Is it still a medication on the table for us to get treated with? And if so, is that taking away from any of our arthritis patients here with needing that medication?
So it's really a two-part question. So one part is, do the antimalarials work? And the other part is, am I going to be able to get my meds, or should I forego my meds so someone who has COVID gets them? So let's answer the second one initially. So basically Health Canada, the Canadian Rheumatology Association, CAPA, other patient alliance groups, big organizations, lobbied the government that legacy patients, so people on hydroxychloroquine already, should get access. And what they found was, at first it was scary because usually there's something like 140,000 pills sold every month by month in Canada of hydroxychloroquine, but the same over the last 5 years. And by mid-March, they were well over 200,000. So you go, uh-oh, there's not going to be enough. So Health Canada, fortunately, has gotten a good supply of hydroxychloroquine and a continuous one from good manufacturers. And they basically made quick contracts and got it. So don't worry about taking it. Please take it if you're supposed to be on it. Don't start it if you're not supposed to be on it. If it's prescribed, please take it. Then the other hand, I think right now it's probably fair to say that hydroxychloroquine is probably a not so sure it works kind of solution right now. So there was one randomized controlled trial, but only 31 patients. So a bigger trial might show other data. And it showed possibly a weak effect. There were lots of uncontrolled observations, but they kicked out in the observations the sick ones. So if someone went to the ICU, they didn't include them. So the sick ones weren't included in the overall data. So when you really read the initial paper, there were something like 16 patients reported on, but 6 not reported on, of whom that they were following, of whom 4 of those 6 went to the ICU, 1 died and 1 took off. They went out against medical advice, and one person had lack of tolerability. So then it doesn't look quite as good, right? So I think we do need a proper large study, which is being done. The WHO, including Canadian sites, is doing a 5-arm trial, and some arms are just one arm A versus B, or standard of care versus something. So I think by the time we get in the second wave, we'll have better data, but I wouldn't hold my breath of it being super helpful. On the other hand, the reassuring part is it's not harmful. Just like the other drugs that our patients are on are not showing this huge surge of bad COVID. So our drugs seem right now, in general, most of them, not to be harmful. High-dose prednisone increases the risk of all infections, especially if someone has, say, diabetes or they're older.
Damn, I can definitely see that. Well, we definitely want to be careful of what medications we are on and only take the prescribed ones as needed.
And no fixed chloroquine. Someone overdosed on that. That's just kind of, it's really sad actually, but they didn't understand that it was like a mega dose.
Right. Yes. Only take it as prescribed.
Yes.
So many of us already have upper respiratory infections from something in the past. And would that put us at more risk for COVID right now?
Right. So first of all, there again, the one question is, if I have a cold, or I've had this cold or cough that goes on, is it COVID or something else? Because last year, the cough that went on probably wasn't COVID, right? It wasn't around. So I think it's really tough for a person to delineate, is this cough relevant or not? So that's the first thing. The second thing is, if in fact you have frequent upper respiratory tract infections during this time, you might get one because you would have anyway. But again, we don't know if you are going to be more at risk of the coronavirus. But I would say if someone gets viral illnesses a lot, even though viruses are different, there's different classes, they're probably at a bit higher risk than someone who hasn't had any infection or any viral infection in the last 5 years. But that's just playing the odds, right? People who get stuff tend to get more stuff. But many people have had colds in my practice that don't meet the criteria for screening. And I think it'll be a long time from now to know if, in fact, they had a very mild case of corona. So I think someday, when we probably have mass antibody testing, we'll find out a lot of things, including asymptomatic people too.
Right. Yeah. I'd like to know myself if I even had it from this flu season, if it was just the flu or what it was. So yeah, I hope that testing does come out soon. As a high-risk COVID-19 patient, is there anything else you would recommend to patients to stay safe that we usually do not think of?
Right. So you want to be looking at all spheres of your well-being. So you want to stay safe by eating well, being good to yourself, exercising, trying to get a routine, calling that positive person on your social media or friends or phone or what have you. You also want to really, I think, look at how you can really take your pulse on your mental health, because people feel isolated. Some people worry more than others. People are grieving the loss of friends, or they might have known people like grandma or someone who's sick with it. I think you really have to make sure that sphere of your well-being is looked after. And I tell people to try not to watch the news too much and to do something positive. So if you love binging Netflix, it's not the end of the world. If you're binging it with like 15 snacks, no exercise, and you forget to take your meds, that's not ideal. But, I think you want to be very holistic. Some people like to chill out with music or reading or spirituality, mindfulness, breathing exercises. There's a wealth of stuff on the internet that can help you where you're at. If you just say, I want to stay less anxious and I want to treat my mild anxiety. If, however, you're really depressed or fearful, or you have thought insertion or sad thoughts, please seek medical attention. Call your family doctor or your specialist and say, I'm just not feeling right. I don't know if it's, because the circumstances are so unusual or what. So there's things we can treat, and that doesn't always mean meds either. So I think if you feel you need help, please reach out to, your trusted healthcare provider if you need it.
Oh, that's great. Thank you so much. Well, that is it for us today. That was our last question. I want to thank you so much, Janet Pope, for being on our chat today and for giving us some professional insight into all of these questions that us as patients and also as advocates are really looking at right now. And I would also like to remind everyone to subscribe below, like the video, and also leave a comment. Yep, right there. You can like it and subscribe right there. Also, we have a hashtag for this chat. It's hashtag COVID Arthritis. And remember to also visit us at ArthrisPatient.ca. I'm Michael Kuluva, and thank you so much for being into this chat with us. We really appreciate it. We'll see you next time.